So, hello, doctors, students of homeopathy, and people working in various fields of homeopathy. A very warm welcome to everyone. So, let's begin the session with a silent prayer. Thank you, everyone. So, today is the 1937th day of the uninterrupted daily webinar of International Forum for Promoting Homeopathy. So, as you all know, IFPH is conducting 3 uninterrupted sessions every day from 7:30 to 10:30 p.m. The recording of the same is getting uploaded on the very next day so that who missed the session can be get benefited from it. You can also watch this session and subscribe the channel without paying any money. So now I like to welcome our distinguished guest, Dr. Yamini Vasishtht. So she has done BHMS from Vaccine Homeopathic College and Hospital, Delhi, and she also having a medical MD degree in HMM from Dr. ML Dhavle Memorial Homeopathic Institute, Palghar, Maharashtra, and she has been practicing homeopathy privately since 3 years, and I am very proud to say that she is my colleague. She is also working as a consultant doctor at Dr. Basil's Homeo Hospital. So I proudly welcome Dr. Yamini Vasishtht. And today's webinar, her topic is understanding evolution of homeopathic materia medica and its clinical advantages. So very warm welcome to you, Dr. Yamini Vasishtht. Please take the session now. Dr. Yamini, now you are co-host also. You can share your video and you can share your screen also.
Okay, am I visible now?
Yes, yes.
Finally. Hello, everyone. Good evening, all the doctors present here. A warm good evening to all. And I'm going to share my screen. Okay, so the screen is visible?
Yes, doctor.
Okay, so let's start.
You can play. Yes.
So today we are going to see how the homeopathic materia medica has evolved and how it can help us in today's practice. As a practitioner of modern day, how the evolution of homeopathic materia medica can help us to understand homeopathy and even how to practice. So it is going to be a theoretical, more of a theoretical topic, but I'll try that. I will try to give you examples and tell you how the materia medica evolved. But it is very important because most of us, in the race of trying to practice and heal, we forget the roots. So this topic, according to me, is very important as a practitioner and as well as homeopathic students. So let's begin. Okay, so my first question is, what comes in your mind when I say the words homeopathic materia medica? I'm sure the students who are still pursuing their BHMS, they'll just think of bulky books with thousands of symptoms. Am I right? Because yes, a part of that is bulky books with thousands of symptoms. And as initial practitioner, or even as when you are experienced practitioner, most of the times it happens that the name of the remedy is in the mind, but we cannot exactly point it out, that we are having few remedies, but we are confused which one to select. So that sometimes do happen even with practicing doctors. So let me start with a powerful statement that materia medica did not evolve to confuse us, but to help us understand the dynamic diseases more clearly. Okay, so this is first of all that you should take home, a lesson that materia medica did not evolve us to confuse us. Okay, it evolved so that we can understand the dynamic diseases more clearly. So today the journey will not just be the list of books. I'll just share the major books of different eras or different types of materia medica, and how they are different from each other. And so it is not going to be just books and authors, but how the medical thinking has changed, okay, how the disease has evolved, and with that also did our materia medica and our practice. Okay, so we are going to explore how materia medica began, why each new era became necessary, the advantage of each phase, what era gave us the advantages, then how with each era our method to study materia medica matured, and how this evolution is going to help the practitioner of today. So first of all, we'll begin with the birth of materia medica, that is the Henneman's era. Okay, so it began in the 1790s, and it was still the era. I have uh, divided them in a way that major, because the eras and the materia medicas are overlapping. We cannot just say that at after 1830 there were no proving, but it's not just that, it is just the evolution. Just to understand the evolution, I have divided the era where we see major characteristics of materia medica, and according to that I have tried to divide the eras. So it was until 1830s that the initial phase of materia medica prevailed. So there was a very good lining which I read in one of the articles, which said Cinchona was to Henneman what falling apple was to Newton and the swinging lamp to Galileo. Okay, so like the Newton got the idea after apple fell on his head, he discovered gravity. So just like that, while reading and translating Cinchona, Dr. Henneman was intrigued by the things given under Cinchona, that it is bitter, that is why it cures malaria-like fever, and he from there he started experimenting on himself and his family and friends, and he invented, he discovered the main principle of homeopathy, that like cures like. Okay, or I must say, let like be cured by likes. So that was it. So before Dr. Hinman's era, medicine was based on basically speculations. There were lack of standardization. There were harmful practices like bloodletting, and theoretical basis that they have theories of humors. So they thought when the blood is more, the patient has headache. So they did the bloodletting and let the vital fluid of our body flow, just in name of bad humors. Okay, so these were the kind of practices which prevailed during or before Dr. Hinman discovered the homeopathy. After his discovery, the medicine shifted from this kind of practices, and he gave us, Dr. Hinman gave us unwavering principles. He gave very principled uh, part of medicine that which we even today we practice. Okay, so they were unvarying, they did not vary over the period of time. It has been more than 200 years, and still the principles or the cardinal principles of homeopathy which we learn, the law of similia, the law of minimum dose. Okay, so all these are still valid, and they are not going anywhere. So first of all, he gave us standard principles, then he gave drug proving. Before that, there were hardly any drug proving on humans. So we understood how the pure effects of medicine are seen in humans. Okay, and hence by this he gave us a gentle path to cure. Okay, before that all the practices were more harmful than doing any good to the patients, but Dr. Henneman gave us a gentle path to cure. So the main books of this era are basically provings. Okay, so first one was Fragmenta de Verbis, which came in 1805. It was by Dr. Henneman, and it was proving of 27 drugs. So it had two parts. The part one had provings of 27 drugs, and the second part had index to the materia medica. Then There was Materia Medica Pura, which came in 1811, and it was revised twice, and it was again by Dr. Henneman. Then came chronic diseases. Here I would like to put some light on the evolution which happened, the conceptual evolution which happened in this era itself. When Dr. Henneman gave Materia Medica Pura, there was no concept of the theory of myasins. But over the period when he practiced and he saw that the diseases were relapsing, so it was out of experience that he came with the theory of myasins. So that was again a evolution which happened in this era, the conceptual evolution of Materia Medica. So Materia Medica Pura lacked that theory of myasm which chronic diseases included. So it had proving of 22 drugs, chronic diseases. Then there was pure Materia Medica by Hartlob and Trinks. We barely know about this, but it also has 60 to 70 drug provings. And there was Staff's archive. So Ernest Staff, he was one of the pioneers of homeopathy, and he had another compilation and a manual kind of how to read and how to memorize the Materia Medica Pura. Then there was Symptom Codex, which was given by Dr. R, and it has around 239 remedies. Okay, so what were the advantages which were gained in this era? First of all, the medicines were no longer guessed. Okay, so earlier they were all mixing of some components, and the medicine whose exact action on human beings were not known were given to given to the patients. But after this, the medicines whose absolutely pure effects on human beings were known were given to the patient. So it was experienced, it was not a guessed. Materia Medica or medicine or the treatment, the mode of treatment was not just guesswork, it was it came out of experience. Then the symptoms were human and not just pathological labels. So for the first time, the symptoms of mind, feelings and emotions mattered, and the patients were individualized. Otherwise it was very common that if someone has a chancre, they would give mercury irrespectively. How it is going to help the patient or rather harm the patient, nobody exactly knew. So in after this, we this advantage was gained that the patients were seen as individual patient and not just pathological labels. Then what was the limitation? Before that, I would like to tell you how Materia Medica was studied. Obviously, it was studied line by line, and it was tried to memorize all those symptoms which were given in the provings, which were seen in the provings, were memorized, which was obviously difficult. So the limitations was that Materia Medica was raw. It was in the language of provers. Okay, so it lacked the pathophysiological aspect, how the drugs are acting on the humans or the patients, how on the provers. So it was in the language of provers, and so it lacked that finness which remedies should have. Then absolutely it was useful, the provings are still useful, which we rarely open up, but I'm going to tell you how we need to revisit our provings sometimes. So they were absolutely useful, but because of the bulk they were overwhelming. The data was so overwhelming because it had all the kind of symptoms, peculiar and even non-peculiar, even seen in one patient or two patients were recorded. So the data was overwhelming. So this created the need for the next evolution. So the next era was the era of expansion and compilation, which we can say it was after 1830s till mid 19th century, 1950s. Okay, again not hard fast limits, but uh, approximately. So first of all, there was need for more crude data because there were remedies which were still not well proven, and also which were proven need to be proved again in a more analytical way. So that need for more crude data led to the led to more provings and compilation. One of the most important proving which had occurred after Dr. Henneman was by Dr. C. Herring, and he has compiled 10 volumes named Guiding Symptoms of a Materia Medica, which is one of the very important provings which we have in homeopathic materia medica. Then there was Encyclopedia of Pure Materia Medica by Dr. T.F. Allen. It had 12 volumes, and it is basically compilation. It had symptoms of Dr. Henneman's Materia Medica Pura, Dr. C. Herring's Guiding Symptoms, also toxicological and empirical sources. Okay, so empirical sources, the past knowledge which is gained. So it included all of it in the Encyclopedia of Pure Materia Medica. So, how I would like to tell you the difference between the proving. So, how the proving had evolved from previous era to this era. So, in the previous era by Dr. Henneman, the provings were more crude and novice, although it was very observative, because as we all know, Dr. Hinman had a very wonderful gift of observation, so everything was fine. But what additional thing Dr. C. Herring did was there was introduction of blinding techniques and placebos. So what if we any of you have read research, so there we had techniques, double blind or single blind techniques in the provings, or the case and control studies during any kind of experiments. So Dr. C. Herring introduced the blinding techniques. He would give the medicine to the provers, and the supervisor who would record their daily, or their collect their daily books, would also not know whether the patient or the provers were given the medicine or they were given the placebo. So that was the double blind method which Dr. C. Herring introduced in the provings, which made it more authentic, right? So we cannot say that the patient knew that he was given pulsatilla, so they were acting in that way. So we cannot say that. They were very authentic symptoms of all the remedies which were seen in the provings. Second, there were clinical verification and grading. So there, the if anyone of you has seen the guiding symptoms of a materia medica, there is grading of symptoms. Okay, so there are double bars, single bar, and no bar symptoms. So the double bar symptoms are clinically verified. Okay, so the symptoms which are confirmed to cure certain kind of disease in a sick patient. Okay, so like we proved pulsatilla, there was a symptom, general symptom, like the patient is relieved by open air. So when we have treated any kind of disease, be it a sore throat, or anxiety attack, or like it was called hysteria back then. So when the patient is ameliorated by open air, and that patient was given, sick patient I'm talking about, not the prover, so the patient was given pulsatilla and they were relieved by pulsatilla. So the general symptom that amelioration by open air is under double bar symptom. Okay, so that is the grade 1 symptom present in the guiding symptom of our materia medica, which are clinically verified. So that was new advancement which were lacking in the previous era. Then there was pathological evolution. So since the previous provings were in the language of provers, unlike that, the symptoms present in the guiding symptoms and also in encyclopedia of pure materia medica, there are inclusion of pathological symptoms also. Okay, so in guiding symptom we see pathological, like for example in childbed, during childbed the symptom was seen in the prover who was already in childbed. So the pathological diseases or conditions were also included in the provings. Then there was schema development, like with the symptoms there were modalities present, concomitant presence, and also the direction of cure. As we all know that it was Dr. C. Herring who gave the law of cure, right? So it was because of his observation during the provings he noticed that there are symptoms which are occurring in certain direction, like from head to toe or from inwards to outwards. So the opposite will happen in the during the process of cure. So that was the observant power of Dr. C. Herring, which was included in the provings, which led him to discover the law of cure. So that was the first one, that the need for more crude data led to more provings. Then the need for pathophysiological understanding led to the clinical and physiological materia medicas. Okay, so I have listed down few important pathophysiological materia medica. So one is by textbook of materia medica and therapeutics, which was given by Copperthwaite. It is very beautifully given how the medicines act on certain sphere of action on certain organs, and what exactly they do in those sphere of actions. So he was one of the pioneers who gave the pathophysiological correlation. Then lectures on materia medica by Dunham. Then physiological materia medica by William Burt. He divided all the remedies group wise, like he has given the remedies which act on central nervous system are given differently. Then medicines which act on spinal nerves, he has divided even that to anterior trunks or posterior trunks. So which are the medicines which acts on bones. So he divided into groups: muscular group, osseous group, the medicines which acts on bones. So then mucus group, remedies which act on mucous membrane. So there is obviously overlapping because medicines which act on mucous membrane may also act on bones. So it was to understand the sphere of action and what pathophysiology they create in those spheres. Then there was a manual of pharmacodynamics and cyclopedia of drug pathogenesis by Dr. Hughes, a dictionary of practical materia medica by J.H. Clark. He has given even the conditions or yes, therapeutic conditions, clinical conditions where the remedies can be used. And this is what is the evolve evolution of diseases we see during the evolution of materia medica, because there were so many diseases which were not even named or coined any named at the time of Dr. Henneman, which later became nomenclature of diseases. So we see, when we see a dictionary of practical materia medica by J.H. Clark, we see that there are so many names of specific names for kind of paralysis, for the kind of neuralgia. So he has given the clinical conditions where the medicine can be used. Then pocket manual of homeopathic materia medica, we all know this materia medica of William Borick. Even he has given the sphere of action and what the remedy does on those sphere of action, and then what are the general symptoms which are seen in the patient, which are very important. Then the schematic presentation of the symptoms. Then the need to differentiate close coming remedies gave rise to comparative materia medica. I hope you all are getting a picture. Like in the second era, what all are the needs which were lacking in the previous era and how it led to different types of materia medicas. Okay, so it is a kind of how I think we all have seen types of materia medica according to their sources differently, and we have seen the medicines or sorry, the materia medica chronologically separately, but it is kind of a compilation that what led to the types of materia medica. We have so much of data, there was like provings had so much of data, so it had to be systematically arranged or systematic to understand. So provings are done. Then what I have told you just now, the pathophysiological action of medicine is understood. Now we need to compare the close coming remedies. Okay, how do we differentiate the toothache of pulsatilla from cophia? So we need to compare the remedies, so that lead to comparative materia medica. here are the four major works: one by Dr. R.H. Gross, Comparative Materia Medica; then Study of Remedies by Comparison by H.A. Roberts; Comparative Materia Medica by E.A. Farrington, one of the most famous and more widely used is E.A. Farrington's Comparative Materia Medica, and Comparative Materia Medica by Kendegabe. So this is very less known book. Majorly we see E.A. Farrington, and I recently got my hands on R.H. Gross's Comparative Materia Medica. He has done an extensive job, and he has even tried to understand remedies by giving analogies. So it is really good work. So I think we all need to revisit all old Materia Medica, which are helpful in today's world also. Then we have so much of data now, then we need to summarize them. Okay, what is peculiar symptoms? Because the back symptoms of aconite are not important, right? So we need to summarize all these symptoms, important peculiar symptoms, and make it short. So that gave rise to keynote or characteristic Materia Medicas. So initial one of the first Materia Medica was in 1936 by Alfred Pulford, then by Adolphe Lippe, Key to Materia Medica or Comparative Pharmacodynamics, then Keynotes to Materia Medica by Guernsey. Those are actually the lectures given in homeopathic college by Dr. Guernsey, which are published in book form in as keynotes to Materia Medica. Then keynotes and characteristics with comparison, which is, I think we all know this. We start our BHMS with the Dr. H.C. Allen's keynotes. Okay, so this we all know how the a schema is from head to toe, and how the important characteristic symptoms are given in bold, then in italics. So this was the schema trying to understand the peculiar and characteristic symptoms. Then was synoptic key by Dr. C.M. Boger. It is again very synthetic synoptic key. The even one word of Dr. C.M. Boger's means, I think pages and pages of provings. He has shortened all the remedies so small, but it is very difficult to understand. So until unless we read the source books, we do not actually understand what the keynotes are saying, because these are the summary of those actual books. So what we read keynotes by H.C. Allen is actually the summarization of Dr. C. Herring's The Guiding Symptoms of a Materia Medica. So once you know the context, you can understand what Dr. H.C. Allen is trying to mean by his single words or phrases. So that will be easier to understand if we go through the provings also. Then what are the advantages gained in the era? So there are different types of Materia Medica which have come up. These, apart from these, there were some regional or monographs, we say, medicines which act just on digestive system, remedies acting just on pulmonary system. So we had those also, but since these were the clinical experiences basically, and to the diseases of that time, they are not very relevant in today's period. Okay, so they were very relevant in those times, but not very relevant today. So we try to understand what advantages we gained in this second era of there are so many compilation, different types of Materia Medica coming up, trying to understand different remedies and the action of remedy. So the main advantages were that inclusion of toxicological and empirical data made it easier to understand the pathophysiology of medicines. So in the provings, in the early provings, the toxicological data was not included, but in later provings, the toxicological data, like how do mercury poison a human. So the symptoms seen when arsenic album or mercury or nitric acid acted as a poison, what symptoms were seen then? Those are the toxicological symptoms. And empirical data is how some remedies were, some substances were used as remedies in old days. So that those are the empirical data, or the experiences of earlier physicians are the empirical data, the researches or the articles which were presented at that time. Those are the empirical data. So all that helped us to understand the pathophysiology, because once we understand what are the symptoms of arsenic poisoning, you will see that there are symptoms of arsenic album present there. So okay, just in a exaggerated and more harmful manner. Okay, so that is how we understood the pathophysiology of medicines. Then the arrangement, it became more systematic and comprehensive, so it was easier to understand and also memorize at the bedside also. So characteristic symptoms and comparison were now easier to understand and memorize, because there are so many comparative materia medica. There are authors which have given the differences of different type of toothache, different type of dysmenorrhea, different type of flow of menses, the kind of pains. How do we differentiate the anxiety of aconite, uh, and the restlessness of Rustox? So how do we differentiate all that? So it was easier to understand and memorize. And then obviously, as we see the patients, we easily can differentiate and come to a final remedy. Then the clinical confirmations, with these there were clinical experience adding up, like this remedy acts better in that. So like pulsatilla acts really good in acute ear pains or inflammation. So all these adding up led to clinical confirmations, which made remedies more clinically reliable. Like I can now be more confident while looking at patients of um, acute sinusitis, when I know all the remedies which act on mucous membrane or serous membrane, or upper respiratory tract, all the remedies, when I know this, I can be more uh, clinically affluent to treat these kind of diseases. Then how the study has evolved, we need to really see that. So there was cross referencing. We can see even in our keynotes, even in comparative materia medicas, how one medicine is cross referred to the another remedy and compared with different remedies on same kind of symptoms. So the cross reference became easier than comparing of remedies, was how the materia medica was studied, rather than just mugging up all the symptoms of the provings. It was no more done and learning from clinical experiences. This is how in the second era the materia medica was studied. Limitation, there was lack of holistic approach. So there were sphere of action. We understand that remedies are acting on mind also, they are acting on digestive system also, but single remedy. But how it is all connected, how the mind body pathology and the energy are connected, was missing. So this led to the another era, the era of holistic drug portraits and group studies. So it started from early 1900s till 2000s. So first we'll look into some materia medicas which give remedy in portrait style. So first of all, we all know that the lectures on homeopathic materia medica by Dr. Kent tries to live the remedy out. Like we can understand pulsatilla as a human being, or Nux vomica as a human being, Lycopodium, Silesia. So we can create a human picture in our mind when we read lectures on homeopathic materia medica by Dr. Kent. Then homeopathic drug pictures by ML Tyler. This is one of the initial works, and very beautifully how the portrait of remedies are given is given. Then homeopathic psychology by Philip Mbelli. And I would like to tell you that homeopathic psychology by Philip Mbelli and portraits of homeopathic medicines by Catherine Coulter, these two are portrait style as well as situational materia medica. situational, as in they are giving certain kind of a situation, and then how the remedy are going to react to that situation. Okay, so it is more lively and more relatable in today's days. Okay, so like if a patient is coming to your clinic and he is just sitting in irritable, ill tempered outside in your waiting area, you can think in your mind the kind of remedies that you are going to give to that patient. Okay, so these are the situation, like someone who is outside is sitting very seriously, but when they come and they start to be pretentious with you, they are very happy and they're talking very well. So you can understand, okay, in this given situation, like he was alone, he was different person when he was not seen, he was not under observation. But now, since he is he has that sense that someone is looking at me, talking to me, he is acting differently. So these are the different situation where we can differentiate remedies. Okay, how pulsatilla will act in certain situation, how naxwamika will act in certain situation, and so on. So these two kind of materia medica are situational materia medica as well, and portrait style also. Then Essence of Materia Medica by George Tholkas and Soul of Remedies by Rajan Shankaran. These are the remedies which gives portrayal of remedies which help us to understand the constitutional remedies better. Then came the group study kind of Materia Medica. So to obviously, when we have so much of data and there are a group of remedies coming up, obviously, like the organic group, inorganic group of remedies, or vegetable kingdom, animal kingdom of remedies. So there was a kind of observation that led to group studies, like how the animal kingdom remedies act, or what are the speed of action, what are their general mental state, or attributes which we can say, like they are these are the any patient is can be a remedy of animal or plant kingdom. So there were characteristics which were seen in the remedies which led to group study. So first one was Clinical Materia Medica by E. A. Farrington, then Homeopathy and the Elements by Jane Sholton. He has given group study as of minerals, obviously, of elements in periodic table. As we see a periodic table and there are elements given in that, so dividing them into those groups, he has studied the remedies and he has given the characteristics of different groups. Okay, then even in the Substance of Homeopathy by Rajan Shankaran. No, the group study of Homeopathic Materia Medica by J.D. Patil. Even he has tried to give the characteristics of animal kingdom remedies differently, how the plant kingdoms are going to act, and what symptoms you will see in spider group of remedies. So these are the group study which help us to come to a group of remedies. Okay, so if someone is very restless and very vindictive, very revengeful, very active, full of life, and they have some kind of nervous symptoms, so our mind will directly go on that the patient is going to be a remedy out of spider group. Okay, so we can think of that. Then we can differentiate at a later stage that which spider remedy this person can be. So this help us to at least come to a group of remedies from where we can differentiate and come to the final remedy. What are the advantages gain of this era when we have studied now the remedies in portrayal manner, in in a more holistic approach? So we learned that materia medica is not just mechanical, it is logical and it is live. So we don't have to just look into the diseases. Okay, we can see the evolution of remedies when we look into these kind of materia medica. So if you read Catherine Coulter or Philip Mbelly, there is evolution given of the remedy, how Naxwamika or Silisha will be as a child, as a teenager, as an adult. So what are the situation which may happen in between, and how they are going to react to that. So the defense mechanism and the adaptive mechanism of remedies can be understood. So you don't just look into remedy as a just you just see some disease symptoms and physical symptoms and just give this remedy. So you holistically see them as persons. Then there is faster access to remedy core, especially by group study. So we can understand certain kind of group, the characteristics of one group. So we don't have to waste our time thinking about all the different remedies. We'll just think of one group. So the remedy selection or understanding the core became easier. So we see, like in cases of remedy sepia, there is the core is independence, that they require that independence. So if they are not given that, how it is going to affect their whole mind and their body can be understood. There is better handling of psychosomatic cases, because now there are so many psychosomatic cases. Everything is related to mind. Something has happened and then the diseases start. So we can understand the evolution of patient, and we can prescribe in the same manner. Then what are the how the materia medica, the study of materia medica has evolved. So studying remedies as living personalities, and how they have evolved, as I just said. And instead of memorizing, we can recognize a pattern. We don't have to, everything we don't have to memorize. Don't have to memorize all the symptoms of sepia. You just understand the core of sepia, then you will be able to prescribe sepia. So you don't have to go to that extent of memorizing the provings. Okay, so now we'll see that how it is important for us. So first of all, we see that materia medica is not just symptom collection, it is dynamic remedy phenomenology. So early materia medica were raw and experimental, but later work was structured, condensed, and clinically annotated. So it is not just static, like we just keep on listing down the symptoms. It is more dynamic. So what is the insight? How is it going to help us? We see that it's not static, it is dynamic, and the remedies are expressing themselves as constitutions, as disease stages, and level of suppression. So how we are going to see remedies nowadays are layered. Okay, the patient do not come directly to you, loudly shouting that they need phosphorus. So you need, because it is layered. There are certain, so many kind of separations, they have gone through so many kind of different type of treatments. So we need to understand the how different remedies are going to react to those suppressions. Okay, so mental or physical, both. So how different remedies adapt to changes. So when we understand this, we don't have to just sit with the our static symptom list. So this prevent us from symptom literalism. What does it mean? Like we are given symptom in book, so we don't have to just see. Like for example, in gelsemium, there is patient feels as if they are going to die. So you don't have, a patient is not going to come and say directly that doctor, I feel I'm going to die, in most of the cases. Okay, so you have to understand, read between the lines, what the patient is trying to say. So like I had a patient who came to me, whose relative came to me, and they told me that during the fever stage, the patient feels that Yamraj is looking at him, and if he will stay still, Yamraj will think that he's god of death, as you all know in Hinduism, so Hindu mythology. So he thinks that if he lies still, Yamraj is going to think that he is dead and he's going to take him away. Okay, so this was the thing told by the relative, but actually what it meant, that he has to keep moving, otherwise he will die. Okay, so that was a symptom of gelsemium. This is how I got. So it is not just mugging up the symptoms. So that is symptom literalism. So you don't have to look what exactly line by line what it meant, smelling bottles, or different kind of phrases which are given. We need to understand the context. So it can be A to Z. The causation or the expression can be A to Z, but you will understand what it actually means. So it helps us to overcome this obstacle if we understand the evolution, like how from just simple symptoms remedies have evolved and became what they are now, how we perceive them now. Then second is grading and reliability. So as we see the through the evolution of materia medica, there are different types of symptoms. Some are pure proving symptoms, some are toxicological symptoms which are seen during poisoning. Okay, then some are clinical confirmation and some are interpretation, especially in few decades, in last few decades there are so many materia medicas and doctors which came up with interpretations of materia medica and repertory also. Okay, so I'm not going to name specifically, but there are different schools of homeopathy which rely more on interpretations. So it is not bad, but how do we interpret is the thing. It comes out of experience. Just pass out BHMS is going to interpret a situation or a symptom differently from experienced one. So these are the gradings on which kind of symptoms am I going to rely more on. So as a initial practitioner, or as I open my clinic and I'm new to practice, I do not rely on interpretations. Okay, I'll be more fact based. So okay, so what physical am I getting, or if I'm getting mentals also, what exactly is the causation? I'll stick to the facts and not on interpretations, or and I'll be more what clinical confirmation I have about these kind of diseases, or these kind of cases. So what are the clinically verified symptoms? My confidence will be on those. So it helps us how to see the symptoms. I just said how to what are the hierarchy and weight of the symptoms. It avoid over reliance on poorly confirmed, exaggerated keynotes or interpreted mental symptoms. Mental symptoms are, it has more harm if we interpret them wrong, because physicals, they are facts. So it is, there are less chances that we go wrong with the physical symptoms. So these are the mental symptoms are difficult. So as a beginner, I would not try to interpret the mentals more. I'll stick to the facts. Okay, so this kind of skill becomes critical in the today's day, because there are so many autoimmune disorders coming up, there are psychosomatic diseases coming up, and multi-layer chronic diseases. So when we see chronic cases, there are so many symptoms of different symptoms of the body which have come at different in chronological order, in different chronological order, and each disease will be suppressed in different manner. So it is all layered. So until unless we know on what kind of symptoms I need to prescribe, so there can be a dog bite in the history, but the patient right now is coming with the cough. Okay, so we don't have to dwell on the history of dog bite. So what is important for now, then the second layer will come up, what we need to treat now. So we need to go in that manner. So this is how um, uh, giving weight to symptoms and identifying the symptoms first of all helps us to prescribe the right mode of treatment to the patient which is coming to us. Then third is integrating multiple materia medica without confusion. So as we have seen that through the evolution, different authors have given different facet of same remedy. Okay, different author, Dr. Henneman described pulsatilla differently, C. Herring described it differently, Kent described pulsatilla differently. But these are all these are not wrong or less of any of them, but these are the different facets. If we see comparative, so there are no mental symptoms, to no much mental symptoms, those are more physical symptoms, but that doesn't mean that pulsatilla do not act on mind. So different authors have given different facets of same remedy, and there is no one single which is complete. there are different layers of truth which are being captured by different authors. So how do this understanding helps us is the practitioner learns to synthesize remedy knowledge conceptually. Okay, we don't have to sit with one kind of we usually see that people stick to Allen's keynote or Boric. We will lose the understanding of remedies in much of extent. We need to compile the knowledge of all the remedies and understand the core. That will help us more. Then cross verify symptoms across sources. So sometimes a patient will come to us who has more physical symptoms, so we'll see the remedies, materia medicas, will refer to the materia medica which are more pathophysiologically oriented, the clinical or physiological materia medica, or the characteristic materia medica, comparative materia medica, we'll look into that. And if we see that the case is more of psychosomatic manner, having more of mentals, then we'll try to understand the remedies through portrait style of materia medica. So that will be easier for us to understand what kind of situation the patient has been through. So that helps us. And when we do this, we make our personal clinical materia medica. Okay, so we'll synthesize, compile the knowledge of all the materia medicas and make our own clinical materia medica, which will help us at the clinic. So it doesn't have to be a book, it can be all in your mind. Then, last and not the least, that this knowledge of evolution helps us to prepare the future practitioner of homeopathy. So, homeopathic materia medica must keep growing, should absorb new new provings, and it should integrate modern investigations tool. So since the technology has advanced, the diseases has advanced, so should our homeopathic materia medica. And it is on us, all the pioneers have done their job. Okay, so instead of seeing the limitations of homeopathic materia medica, that it do not include this, that, and the investigations tool, it is in our hand that how we are going to evolve our homeopathic materia medica in today's technology, in today's disease, and in today's polluted world. Okay, so the food, air, water, everything is polluted. So how do we relate all those old knowledge to this new era is on us. So, an evolved physician must observe like Hahnemann, understand philosophy like Kant, differentiate like Farrington, because he has given very well comparisons, synthesize like Boger. There's no better, synthesizer or analytical expert as Boger, and adapt like modern physician. So this is how we can inculcate this knowledge of evolution in students as well as in practicing homeopaths, and practice better, because compilation is really important. We have left out the provings which are still important, because it has symptoms of the diseases which are still not named. Okay, so nowadays we are coming up with digital addictions and all. So there can be symptoms of these kind of diseases, modern diseases, in our provings. So we just need to revisit them with this new mindset. That is all we need to do. So that is all. I think it was helpful, and it will help all the practitioner as well as all the BHMS students to understand homeopathy better in, and not make it boring. So homeopathic materia medica is not boring, it can be interesting. You just need to look in a right way and in the right books. That is it from my side. Anyone needs to uh, ask something or add to the knowledge?
Yes, Dr. Yamini, it's a really very good session. I'm inviting Dr. Abida Salim to say a few words. Uh, Dr. Yamini, can you make Dr. Sudhi Saria unmute? As there is some problem with my network.
Dr. Dr.
Suruchi Saria. Please ask Dr. Suruchi Saria because she was the host, but unfortunately, it was changed. You are a
Thank you.
co-host.
Yes, sir.
Yes.
Yes, due to some connection issue, I got left for few seconds only, but somehow I got out from the session. So, but I was there whole through whole session, and it was really very beautiful and very informative session. And I just wanted to say that yes, you said very very correctly that these new era, we need some more drug proving with some keen mind, because nowadays so much new type of symptoms coming, some the disease age, their age are also getting lesser size now, kids are getting obesity and lifestyle disorders. So yes, with keen mind and with very with analyzing all those things, we need some more provings with and just you say that materia medica is just not a big thick book. It's all of us know the importance of materia medica, and yes, Dr. Hanneman did a very great job. He did that, he wrote that materia medica pura, that is the essence of all the miasmatic symptoms and all. So it was very very great session, very informative. And for students it must they can more read more search on these materia medica things, and how they we can use on which symptom basis we can use different materia medica according to our case also. Sorry, I was having cough and cold. So all the materia medica are having their own plus point and negative point. Not to say negative point, but some materia medica are very useful in certain type of cases, and we can go through all the provings. Like these days, new medicines are getting proved, and all the symptoms are coming according to those symptoms and those medicines. So we should get updated from those materia medica about those new medicines. So it was really very wonderful session. And sir, I'd like to invite Dr. Abida Salam for vote of thanks. Dr. Abida, Dr. Yamini, can you unmute her? Dr. Abida.
Oh, you can make co-host Dr. Abida. Dr. Yamini?
Yes, I did.
Hello, am I audible?
Yes, doctor.
Yes, doctor.
Yeah, thank you. First of all, thank you, Dr. Yamini, for an in-depth session regarding Materia Medica from the initial phase till throughout all the types of the Materia Medicas you have gone through, and how we can differentiate between, or in fact, you have gone into sort of like, which Materia Medica focuses more on what kind of, features, and which is more suitable for that kind of. And thanks a lot for the in-depth session. Probably, like you
While
said,
doing
that-
research for this topic, I thought that it will be very interesting to have another session on a single remedy, like for example, pulsatilla, how different, how it has evolved through different eras. So that is another topic which I am very interested in, and I will surely think of it and prepare a session on how one remedy we can study it, and how we can see it in patients, how we can differentiate pulsatilla with others. So a comparative and evolutionary understanding of remedies. So
Okay, thank you so much, and thanks to all the participants also who have been, through the session throughout, and obviously thanks to IFPH also for arranging such sessions daily for the information of all,
yes, it is
including not only homeopathic doctors, yeah, and all the homeopathy lovers too. So thank you all.
thank you.